Hello, everybody. Welcome to Post Woke World. My name's Jennifer. I've been away for a little while, but I decided to come back on. I wanted to talk about Lindsay Clancy. I actually feel compelled to talk about this case. And I've been thinking about it for a while. It's one of those cases that if you've been in the medical system, you've worked in it, you know how things work, it can make you really angry, to say the least. But I think there are other ways to look at it, and we're going to discuss that. What if one of the most disturbing criminal cases in recent memory isn't just a crime story? What if it's a medical story? And what if, as uncomfortable as it is to ask, the system we trust to protect vulnerable mothers is being tested in a way it has never been tested before? Today, we're going to talk about the Lindsay Clancy case. I'm not doing this for shock value. I'm coming from this in a different way. We're doing this because medicine, psychiatry, and criminal law collide, and that's what's happening in this case. And we should all be paying attention to this. I'm not really going to speak about it casually as I might some other cases, only because this one sort of touches on things I have direct experience with. I've told you guys before, I'm a physician assistant. I've practiced in the medical field for over 20 years. And I've practiced in various settings, including an emergency room in a level 1 trauma center, in internal medicine. I create a weight loss clinic. I worked in primary care. I prescribed medications. I screened patients, and I saw what would happen when SSRIs, which are acronyms for sustained serotonin reuptake inhibitors, when SSRIs, I saw what happened when they were helpful, but I also saw what happened when they weren't helpful. I practiced before they had the black box warning on SSRIs that was added for teenagers. And I watched as teenagers were activated and became manic, and suicide rates went up. And there was a lot of misunderstanding as to what was going on until they realized when you prescribe these SSRIs to people who have a predisposition to bipolar, you can make them manic. And when people are manic, they do things that will increase risk for everyone, including themselves mostly. And so that's why, in case anybody wasn't familiar, black box warning is on all SSRIs now. I don't know if your doctor or whoever prescribed it to someone like yourself or in your family or anybody that you know that's a child talked to you about it, but they should be talking to you about that if they're prescribing this medication to you, because they should be screening you prior to prescribing it and then watching for symptoms of mania develop in case you do develop those symptoms. The point I'm trying to make is the conversation for me is not theoretical. Now, the case involves children, right? I mean, it involves the deaths of 3 children. And of course, that's the tragedy at the center of it. But the legal system, which I've discussed what I think about laws and government in the past, but we live in a world where there is a government and a legal system, and we know that laws don't mean morality. There are laws that are immoral, and there are moral things that are legal. So we know that doesn't equal the same thing, which means it's not truth. It's just another layer of deception. But regardless, we live within a world where there is a government, and we pretend like these laws and whatever. Okay, so legally, is that murder? Okay, but we can't ignore the reports that indicated Lindsay Clancy was under psychiatric care, that Lindsay Clancy was prescribed medication for postpartum mental health issues. When a medicated postpartum mother commits an act this catastrophic, the medical system is part of that conversation, whether people like it or not. Not because medication is always going to cause harm, and not because the psychiatry is the villain, but it's because the medicine is not risk-free. And pretending it does not protect women. The problem is the lack of care taken when these medications are prescribed. These medications can be life-saving for the right people. But when people like physicians or PAs or nurse practitioners become like a fast food takeout, would you like fries with that? Because someone comes in and asks directly for an SSRI because they're depressed and their mother's on it and their sister's on it, and somebody just flippantly writes it without screening them for mania, history of suicidality, and all of these things. And we all know that this happens every single day, over and over and over again. I know it happens because I watched people do it. I didn't do it. It doesn't make me better than anybody. Again, I'm not better than you. You're not better than me. I'm pointing out something that I feel this case is going to highlight, and that we can no longer ignore about the medical system. I called my mother up before I did this. I was actually crying because I was so upset by this whole thing. It broke my heart. But my mother said something really important, and it turned it all around. And she said, no, it's good that they charged her. It's good that they did that. Because now we all are going to go through and witness exactly what she had to go through. She's a nurse by training. So this is someone that is not familiar with how to navigate the system. When you're in the system, it's so much easier. That's why it's great when you have a friend that's like in the system, like you call them up, they can make magic happen within that system. Lindsay Clancy was a nurse, and yet this happened to her. So that means it can happen to any woman, and it's highlighting the lack of care taken. This woman went to the top psychiatric hospital in the country, admitted herself. She said, help me. And this is what happened to her. This is what happened to her. So yeah, it's sorry, I got a little bit irritated, but I just want to try to frame it a little bit more neutrally for people who don't understand how something like this could happen and how a woman could do this, and how the greatest suffering she has is just breathing right now. And so, anyway, sorry, let me just get back to my show. So 3 kids died, right? Like, obviously, tragedy. And she's been charged, and the legal system is going to determine if she's criminally responsible. But this has sparked a national debate because reports indicate, like we said, she was under psychiatric care. She was prescribed medication for postpartum mental health issues. And that opens up a very serious conversation is how do we treat postpartum women in this country? I'm smiling because I already know the answer, but I don't want to say it. I want you guys to think about it. Are we monitoring postpartum women enough? Are we being careful enough with them in that very, very tenuous state that they're in? I get it. They gave birth. People think the final show is over, but it's not. It's not over. You're still in a very precarious situation, particularly, I mean, for other medical reasons like preeclampsia, you can get post-eclampsia, you can have a stroke. I mean, there's a lot of things, and it's not to scare people. It's just to say that after birth, you're still in danger for a little while. And mentally is one of them because hormones start to shift rapidly. And if you have any history at all of depression in your family, remotely, it could trigger something. And it's not to scare people to not have children. It's still less common. It doesn't happen often. But the idea is it happens. And if you're in the medical field, these are the cases you look for to save lives. These are the reason you go into medicine because most people are going to be okay. Most people you reassure. A lot of medicine is just reassurance and understanding, explaining. But these people, Lindsay Clancy is the person you go into medicine for to save her when she comes in and begs you for help. And nobody could do it. And that's a problem. That means this has happened a million times. It's just gotten so bad that we see a Lindsay Clancy. The odds are in. This is happening all the time, constantly. This case is highlighting it. And so that's what my mother said to me. And I was like, you're right. This case is going to be very important. And it could revolutionize postpartum care in women. It could revolutionize a lot of things because we are one of the countries, unfortunately, that does not have infanticide laws. See, in other countries and in certain cultures, they understand that women do this, that things happen. I'm not saying to excuse it. I mean that they offer supports and they monitor because they understand it's a condition. I'm not saying there aren't malevolent women out there that kill their children. I'm not saying that. I'm just saying this is not the one. It's just not the one. So what makes it complicated is postpartum depression is common. I personally had postpartum depression. It's very common. The psychosis part is rare. That's the rare part. That's where medical expertise matters. Okay. A lot of people can diagnose postpartum depression. It's really not that fucking hard. Okay. Sorry. Let me calm down. The whole point of going into a medical specialty, the whole point is to find the needle in the haystack. You don't want to think everybody's the zebra, but you need to have that experience and you need to care enough to know that if you don't know, there's something off, I have to investigate. So yes, postpartum psychosis is extremely rare. But when you live in a state like Massachusetts, where there's a psychiatrist on every corner, where you have top women hospitals, allegedly, and top psychiatric hospitals, allegedly, and you're a educated woman who is a nurse, and you go and you beg for help. I'm saying beg in the sense of like, what more was she to do? I'm just curious. Sorry. That was a tangent, by the way. I try to limit those sometimes because this case is it's really important, and it's really important for people to understand what's happening here. It's very important, because I have heard people say, like, you know, pretty, to me, like, shocking things about what should happen to Lindsay Clancy, and I'm just like, okay, that's what, my mom's right. This is why it's happening. People need to understand this. If they haven't experienced it themselves, or had a relative or work in the medical system and experienced it, they have no idea. And that's kind of coming back to the whole thing I always talk about on my channel, no matter what we're talking about, which is compassion, which is trying to understand the other person, not in judgment, in collaboration, not in order to manipulate and confuse, but to understand and seek truth together. So of course it sounds horrific. This woman killed her 3 children. Of course. And you might say, well, we shouldn't have to ask why. That's just horrible. She should just be put to death. That's called black and white thinking. There's no nuance. And you know who behaves that way? Animals. Animals behave that way. I prefer to behave more like a human, and in the way that Christ intended us to. Not animal-like, not quick to judge, wanting to collaborate and understand. So yeah, postpartum psychosis is very rare, but it's the whole thing you learn about when you go to medical school or whatever school you're in where you're treating people. That's the thing. It's kind of like, look, there's a ton of people that can come in and they have belly pain. Okay? A ton of people can come in and they have belly pain. What's going on? There's a ton of, sorry guys. Sorry, I'm going to start. So I'm not laughing at this. I'm laughing at Jenny. It just makes me laugh. I'm sorry. Anyway, sorry. Listen, it's like abdominal pain, right? Most of the time, abdominal pain, I'm just going to be honest with you guys, after examining thousands and thousands of patients, the majority of the time abdominal pain is you're constipated. Okay, that's almost always it. Almost always it. However, I can't say that for sure. And the things I'm trained to detect are the dangerous things like appendicitis, right? Or cholecystitis or AAA that's going to burst, okay? These are the things that we train for. This is why when you go to the hospital, you want someone like me who's trained to determine what that is, right? That's the whole idea, to see people, right? And so when someone has postpartum psychosis and you're a psychiatrist in the most, allegedly, most like excellentist in the country, and you have a woman who is an educated woman in medicine and knows how, she works in OBGYN, I think. Mind blown. Head going off and spinning. This woman, I'm pretty sure Lindsay worked in OBGYN. So of course she knows. You don't think she said these things to these people? I can't wait until I see the notes. She told them she was hearing voices that were commanding her to do things. She told them that. And yet they still did not consider, oh shit, maybe the SSRI is making her a little manic. Maybe she's bipolar. I know it's rare, but that's why I went to medical school, right? To pick this out. That's the whole point of doing what you do. Most of the abdominal pain, it's constipation. But if you miss the AAA and they die, it's your fault, boo. I feel like the wrong person is on trial here, if I'm being honest. Look, SSRIs are widely prescribed. Probably people in the chat. I haven't looked right now, guys, because I'll get distracted. And I love talking to you guys, and I will definitely check it out. But I have to stay on track on this because I think it's important. They're widely prescribed. A lot of people are either on them, have been on them, know somebody on them, that kind of stuff, okay? And they help people. I'm not going to deny that there are a certain group of people that they can help. But they carry a black box warning. And we talked about this in the beginning. And the black box warning for all SSRIs is that it can trigger agitation, mania, and destabilization. particularly in people who have bipolar disorder that has not been diagnosed. Okay. And so the question becomes, what happens when this treatment intersects with the tragedy? What I'm going to tell you, are we willing to look at that honestly? We have to look at that honestly. So the thing about it is, did you need something? No. So anyway, it's just a little distracting. Like I'm trying to do the live right now, so it's super distracting right now. It's very distracting because I'm trying to do a live, and it's extremely distracting. Like I can't even remember. Sorry, guys. So anyway. Sorry about that, guys. All right. So the SSRIs are like widely prescribed. And in certain cases, like I said, they can trigger agitation, mania, destabilization, especially if the bipolar is present. Okay. And it's undiagnosed. And like I said, the treatment for the depression caused the mania, caused the psychosis. And what happens is it went undiagnosed. This happens a lot. This isn't the first time. But the problem is this time, look at the harm that was caused by the lack of care of the people who were supposed to be caring for this woman. Look, if she didn't go to the hospital, she didn't try to get help, nobody helped her, and she did that, I would still be most likely on her side. Because this happens to women. They need support and they need I would still be on her side because here's the thing. She tried to kill herself too. She's actually in a wheelchair right now. She's in a wheelchair. Her husband is remarried. State of Massachusetts is apparently holding witch trials again. I mean, first we had Kelsey Fitzsimmons and now we have Lindsay Clancy. Is that coincidence that this stuff is happening in that state? I don't know. And, we also had Karen Reed. Let's not forget her. But this isn't about blaming doctors, okay? It's not. But it's not about dismissing accountability either. Yeah, I can't do that. I can't allow that, right? It's about examining whether there are blind spots in the system. And I think we all know there are. If you didn't know, after COVID, I think you knew. If you didn't know then, I don't know if you'll ever know. But here's something that doesn't really get talked about enough, right? Postpartum women are often exhausted. They're sleep deprived. Their hormones are shifting. They're vulnerable. And many feel that they are dismissed. And many report being told, just take the medication, you're depressed. How many are told this, though? Do you get agitated on the medicine? If you have racing thoughts, if you have sudden behavioral changes, call us immediately. Nobody's told that. Yeah, I know on the packaging, I know on the pharmacy thing it says that. And yes, I know on the discharge papers your doctor gives, it says that. But does your doctor or your PA or whoever prescribes it turn around and actually look you in the eye and say to you, I'm sorry you're going through this. I want you to try this. But I also want you to understand, I don't see any bipolar symptoms in you. You don't have any reason. However, if you have racing thoughts, increased agitation, thoughts of harming yourself or other one, contact me immediately. How many doctors do that? I did that. Not because I'm better than you, not because you're better than me. It's because I'm so fucking conscientious that I had to do that. I had to do that. Okay? So, yeah, I did that, but I also know most doctors don't do that. The reason I know that is because anytime someone came to me for a vaccine, I would give them informed consent before I told them to just sign something and take a vaccine. And all of those people, almost all of the time, left without getting the vaccine and were surprised at the side effects because no other doctor had told them, or PA or nurse or whoever had gotten through and told them the actual harm that could be caused. Yes, it's rare. Yes, it's not common. But what's the risk? How many measles vaccines does it take for you to save one child? How many? And then ask how many people get a measles MMR vaccine and have side effects? There are answers to these questions. Are families educated about it? Did her did her husband? They probably did, and he knew because she's a nurse in the OB ward. So like, if you saw, I was watching the Defense Diaries, and I love them. They're like my favorite couple on YouTube. They're the cutest ever, and I feel like they're going to be married for like 100 years or something. You know, like they're the best. They give me hope. But the thing about it is like, she was going through the affidavit. And if you didn't listen to it, you should go listen to it. She was going through it, all the things that Lindsay and her family and all these things try to get help for her. And it wasn't a little bit. It wasn't just a little. They really, like I said, she admitted herself into like a psychiatric hospital. She said she was hearing voices telling her to harm her kids. I don't know what else you expect the woman to do, honestly, or her family. So I was actually outraged when I found out they were even charging her. Sorry, that was another tangent. The question is, do we hand out prescriptions in a system that doesn't have the bandwidth to monitor them properly? The answer to that question is yes. That's the answer to that question. Yes, we do. So we might not have all the answers by the end of this, but maybe we'll understand more why the case has divided the public, because it's really about the medical system being questioned here. Why conversation around postpartum psychiatry is really just starting. This is really just a new thing. So I definitely want to hear from you guys in the comments about this, like what your experience has been in the medical system. I think a lot of people have these stories that that go unheard. I think I played you guys my song that I made. You want fries with that about the medical system? It's stupid, but it's true. It's like you go in, you sit down, the doctor looks over your labs, you're complaining of fatigue, and they're like, yeah, everything's normal. Your iron's fine. You're not anemic. Your thyroid's always going to be normal, almost always. It's rarely ever your thyroid, but okay, check it again for the 100th time. That's normal. And then they're like, yeah, everything's fine. So your fatigue is just, it's just stress, whatever. Bye. See you next time. Or they refill your blood pressure medicine that you probably don't need, or your cholesterol medicine that you probably don't need. By the way, this is not medical advice. I'm not telling anyone to stop any medications. I'm being facetious, but do they really explain to you the risks of it, why you're on it? Do they reevaluate it, or are you on like 50 medicines this long that interact with each other and they're actually causing your problems now? Because that happens all the time. I've seen that so many times. Most of the time when I see patients, I'm undoing the problems that were done to them when they went to the doctor to get help. More people need help undoing the shit that the doctors did to them right now, truthfully. in my opinion. That's just my psychic. I'm just, you know. I told you guys before, I had a woman who came in. She was in her 30s. She kept complaining of being fatigued and tired. And everyone did all the blood work on her, you know. They even did a stress test on her. Don't smoke. Go to bed at a certain time. She did all the stuff. But what no one did was a sleep study. I did a sleep study, but I didn't just do it for sleep apnea. I checked her for narcolepsy. And she had narcolepsy. The woman had narcolepsy. She got diagnosed in her mid-30s. And then she got treated and everything was different. But the point is, I didn't just tell her she had fatigue again. So there's some cases that shake people because they're violent, like the Idaho 4 case. And then there are cases that shake people because they force us to confront something that we don't understand. And this is one of those cases. There's 3 kids that are gone. The family is shattered, and this mother is sitting at the center of a storm that most of us hope we will never have to experience. When postpartum mental illness becomes severe, and when reality fractures, it does not look like sadness. It looks like confusion. It looks like terror. It looks like something the outside world struggles to comprehend. You guys don't have to like tiptoe around. It's actually more distracting. I don't know. Ask Jay. He came in here 20 times interrupting me. And then I'm like, I don't know what he's doing with the dog food or any of this stuff. I'm just trying to, sorry guys. Let me just, it looks like confusion. It looks like terror. It looks like something the outside world is going to struggle to comprehend. But postpartum psychosis is rare. It's about 1 in 1,000 births. We talked about that earlier. And so when you work in medicine long enough, you learn something important. And that is rare is not the same as impossible. When rare events happen, they test the system. So they test whether screening was thorough, whether warning signs were recognized, whether medication effects were monitored closely enough, whether sleep deprivation, hormonal shifts were taken seriously. They test whether we are humble enough to admit that medicine is powerful, but not perfect and not the cure-all, and possibly not needed at all in that moment, but something completely different. And as a clinician, as a PA, I have seen and prescribed Prozac or Zoloft, and I've seen it change somebody's life. But I've also seen it activate mania. I've seen it destabilize. I've seen these people in the emergency department when the risk factors weren't fully understood. It doesn't mean the medicine is evil, but it does mean it requires vigilance. And I personally think at this point, in the way the system is operating, ever since managed care took over healthcare and doctors didn't do their own thing and have their own secretary, it's all just become a business. And that's why I say, would you like fries with your labs? Because they even have these stupid Press-Ganey scores when I worked at Yale, where like, if you didn't get a good score from the patient, it affected your salary. I don't care if the patient likes me. I'm trying to save their life. If they don't like me, I'm answering to a higher calling here. If they don't like me, tough shit. Right? That's crazy, but that's what they do. That's demonic. That's inverted. That's not real. That's false. They don't give consent, informed consent. I did. But try working and doing that. People don't like it. Sorry, that was another tangent. Anyway, postpartum women deserve aggressive follow-up, not just prescriptions. And the hardest part is when something like this happens, the public just sees a headline. But behind that headline is Lindsay Clancy. And she was in a psychotic state. She wasn't experiencing a reality that any of us have experienced. And nobody is going to mourn those kids more than Lindsay Clancy. Nobody. And it doesn't erase the tragedy of what happened. But like, let's look at why it happened and who caused it. Who really caused it? If it teaches us anything, it should not just be outrage. It should be urgency. And the urgency that I feel from this case is to talk more about the problems in the medical system. And this is just the start. And that's why I want to follow this case, because this will help improve screening. It will help educate families. It will help create an urgency to treat postpartum psychiatric symptoms for what they are, medical emergencies. This urgency will help make sure that no woman falls through the cracks because her suffering didn't look dramatic enough. Protecting mothers is protecting the child. And the only way to prevent the next tragedy is to be willing to look directly at this one without fear and without denial and without simplifying something that is profoundly complex. Rare does not mean impossible. It's the whole reason why we train in medicine, to find the Lindsay Clancy and to prevent the tragedy from happening. So if we truly care about families, we have to care about the maternal mental health before the crisis happens, not just now, and actually after childbirth. We have to remember a woman's state is very fragile, actually during the whole pregnancy, but right up giving birth, women used to die all the time giving birth. Now we help them survive, but they're still in that fragile state afterwards. So yes, to me, it is absolutely outrageous that the state of Massachusetts once again is doing this to a woman, but it just mimics what they did to the witches in Salem. First it was Karen Reed, then it was Kelsey Fitzsimmons, and now it's Lindsay Clancy. And it just keeps getting worse, doesn't it? They charged this woman with intentional homicide of her three kids. She jumped out the window too because she wanted to die. She's in a wheelchair. Her husband left, got remarried. She's a nurse, and before any of that happened, she admitted herself to a psychiatric hospital. And all of the warning signs, all of them were ignored. And so people need to be held accountable for this. And the system needs to look at itself. Because like I said, it's like a speeding ticket, right? Everybody speeds, but you don't get a ticket. Some people go their whole life never getting a speeding ticket. Why? Because they don't speed enough. They don't drive enough and speed enough that the statistical probability for them is going to get a speeding ticket. There's always going to be outliers. It happens. But the bell curve, most of the time, if you drive a lot and you speed a lot, eventually you're going to get a ticket. If you don't drive a lot, speed once in a while, you probably won't. Same thing with this. If they had their shit together in the medical system with postpartum care, this would not have happened. The fact that it got to this level at the place that it got to, this didn't happen in like some third world country, or I don't even want to call it that. I don't want to like to say that about countries. It didn't happen in a country where they don't brag about how great they are, like McLean Hospital, the best psychiatric hospital. That's where it happens. If it happened there, what's happening everywhere else? That's the whole point, right? It means it's broken. It means it's completely broken the way that they are looking at women in this postpartum state. They are not taking the care that they need to. They are not advising them of the warning signs to think about for mania and bipolar, which they are at risk for, particularly when they're prescribed an antidepressant, particularly when they have postpartum depression, which is common. If it's happening at McLean Hospital in Boston to a registered nurse who works in the field of obstetrics, you can bet your bottom dollar it is happening everywhere 100 times fold worse. We just don't know about it. We just don't know about it. So I'm going to say hi to the chat, and then I have something fun to show you guys before I go off. Hello, Mima Nancy. Thank you, Doc Terry, for being here. Good evening, James Lynch. You're very welcome. I'm happy to bring these topics up. So many medicines in a short amount of time. Good to be here. Unfortunate subject, but important. If you appear normal, but yeah. Yeah, it's absolutely infuriating. So, this is the topic that'll open up things for me because I told you guys before I want to get back into medicine in some capacity. I want to help people, but I don't like I'm not saying the whole system is horrible, but I'm saying that the system has been overloaded and taxed, and there are people I believe that are just sort of operating on some level that they're not recognizing the harm that's being caused. So, I'm trying to create a positive change, point these things out. That's the only thing we can do is how we react. I can't change the system. I can talk about it, but I don't want to just complain. I want to actually make a change. I don't know where that's going to lead me, but I'm going to just walk in faith that it will lead to help people. And that's where we're starting. My niece is bipolar. She's on 10 drugs. I'm so sorry. I'm so sorry to hear about that, Billy Love. Yeah, I'm only laughing, Cakes, because I'm with you. I mean, a man with 2+ years presents with drop foot and unable to breathe. I mean, there's a lot of questions I could potentially help, but that's definitely an interesting opener. I have a lot of other questions. Drop foot isn't always something that is permanent. There are some things you can do to help. Typically, it's a local nerve. I mean, that's usually a local nerve problem, not a stroke. And then the unable to breathe, I mean, there's a lot of things. Absolutely. No, I can't. I just cannot. Oh, here we go. 2 years of muscle loss, low O2 sats. I almost said ALS. I would have told you ALS. That's it right there. Right before you said finally to get to the ALS. Do you know? I'm really sorry about that. Do you know I had a patient with ALS, one patient, and this is what happened. This was devastating for him and for me. And I also had a friend die of ALS, and I saw her 2 weeks before she died, and I'll never forget it. But this guy came in to see me. He was a mechanic, and he said to me that his fingers were getting numb when he was working on his car. And I was like, oh, that's probably carpal tunnel, but let's talk. So I talked to him a bit, and he was describing, this numbness that would happen more at nighttime, he said. But it wasn't in the ulnar nerve distribution or the median nerve, right? It wasn't like, if it's carpal tunnel, it's usually these two fingers and this, okay? And usually it's at night and you wake up and you're like this. And if you wear a splint, it helps. Only 50% of the time the surgery works, whatever, right? But I'm saying to him, you're a mechanic, this and that. You're dropping things. It looked like he had a little thenar atrophy. So after I did the whole talk with him, I immediately said, I think it's carpal tunnel, but let's set you up for EMGs, right? Which is electromyographs, right? To test the muscles. And I also, he told me that he had a little bit of weakness in his lower legs. And I'm like, okay, well, we'll do them there too. Why not? You're just going to do it. So we did that. And then I did a whole bunch of, I'm trying to remember how it worked out. Because it was 2 visits. It was 2 visits, I remember. And then he got the EMGs, and then I got the call. I remember now. I set him up for the EMGs. I got the call from the doctor telling me that it wasn't peripheral, that it was central, and that he was concerned for Lou Gehrig's. And I mean, I was just, of course, that broke me. Obviously, this guy was like, I don't know, he was fairly young, like in his 40s or 50s. And It was rough. It was hard. But yeah, that shouldn't have taken that long. 2 years. My friend who had ALS, it took her a while too, but not too. She went and this is the typical road for ALS. The typical road is you get worked up for multiple sclerosis, you get worked up for Lyme disease, you get neurosyphilis, you get worked up for these kind of things. And then it just becomes so obvious. That's the typical. The same thing with multiple sclerosis. These are the diagnoses that I learned after treating a lot of patients to catch very early, because I knew that those were the ones that got neglected. So you have to make your vision razor sharp for these people. Like people with endometriosis get overlooked. I can tell you the patients that I helped with endometriosis, because the rest of the world or whoever they saw said, you're crazy, or you don't have a problem, you're all set or whatever. And I look in their chart, and all that's ever been checked for is one time they had a scope, and the OBGYN said they don't have it. And I'm like, that was one time, but your symptoms are all exactly aligned with endometriosis. So why don't we get you a second opinion? And I sent for a second opinion, and lo and behold, the other OBGYN completely missed a shit ton of endometriosis inside of this woman's uterus. Okay. And this woman was suffering for 2 years because nobody else would simply just say, maybe the other doctor fucked up. Because guess what? They fuck up all the time. Sorry to tell you, you probably know this already. This is why I stopped practicing in that field, because it made me crazy. But I'm starting to recognize that I have to do something, because I had a relative go to the emergency department recently because they had a bump, and they did a CAT scan because they weren't sure if it was a hernia, and it was a freaking lymph node. Okay. I'm like, who are these people? Who are these people that do a CAT scan for a lymph node? I need to see these people. So I'm speechless about that one. Anyway, that was another tangent. Let me let that one go. Let me stop. Let's move on here. I'm really sorry to hear about that, silly. ALS, yeah, with my friend, it took them a long time, 6-7 months. And then when they diagnosed it, she was only alive for another 7 months, and she died. And the last time I saw her, she couldn't move, and she could barely talk. She had a pulmonary embolism, and she decided, she was also a nurse, and she knew, why was she going to take a blood thinner? What's it going to do? What was the point? She had come to that point. But the hardest part for me was sitting there witnessing her like that, crying and telling me that it's not fair and she's not ready to die. She had a young son. That has bothered me until I decided to look at that in a different way. And it no longer bothers me. I feel gratitude for being able to see her in that state, to help witness that for her, to hold her hand, to tell her I love her, to give her a hug. I feel grateful for that movement, because it makes me grateful every day for being able to walk and breathe and everything else. Yeah, silly. You got me. Hello, Spicy Misty. Yep. He got remarried. Not knowing what they're there for. It's so disturbing. I can't tell you. And my relative, it's the third CAT scan, and it's a young woman. So, like, what are you doing? It makes me so angry. The last time I went, the doctor was like, it could be appendicitis. I'm like, okay, but like, she doesn't have rebound. She doesn't have any, like, can we just wait? Also, ultrasounds work really good. Maybe I'm spoiled because I worked in the ED at Yale, and we had point of care ultrasound. We could just put it right on your stomach and look at your appendix. And if the person's very, very thin, you can see it without a CAT scan, and surgery will come and they'll look. And they have done surgeries without the CAT scan if they're good, because that's what real medical people do. They don't just order fucking tests. and a shot in the dark. I'll just order a bunch of tests because I don't know what I'm looking for. Anybody can do that shit. The real art of medicine is to understand. I'm blessed. I was able to see what people's problems were almost before they even told me. But anyway, sorry guys. I have to get going, but I want to show you guys this before I leave because I finally got these in the mail. I got this. Auntie Deb sent me my cards from Classroom 203 Garbage Pail Kids. And these are so awesome. Let me show them to you. Hold on, Winnie. I'm going to let you out in 1 second, buddy. All right? Once I let you guys in here, like, it's going to just be crazy town. We're going to talk about, I told you guys we're going to be doing the medical channel. And, yeah, there's a lot of topics we're going to go over because there's a lot of confusion. And I want to really help people get through some of that stuff. All right, so here is Maya, munching Maya. Okay. Here is Peg Leg. I got a Peg Leg. And story about Peg Leg. When I first got into when I went up to Massachusetts with Leslie, my previous moderator, we drove by John O'Keefe's house. And we kind of like slowed down and looked at it. And as we were leaving, Peg drove into the drive. She went to the driveway and she got out and she was looking at us. And I was looking at her and I was like, oh my God, there's Peg. Isn't that funny? It's ridiculous. I know. So I'm really excited that I got the Peg Leg because I love Peg. I love Peg and I would never call her nasty names. Okay. Then I have this one. I'm so excited. Madonna Edelson. She has the list. Look at her. Oh my God, there's so many awesome details on this. It says espresso, evidence, extortion. It says Bubby on her slippers. I love it. It says Bubby. To-do list. Call Charlie, call Rashi, call Harvey, take acting lessons. That one's not checked off. I don't fall. I descend. I freaking love it. This one I'm really excited about too. I got a Staring Karen card. Staring Karen. I loved when Karen looked at him like this. Oh, that was everything. And then this one's adorable. Emily C. Word. I love Emily C. too. And it's so hilarious. I just love it. It says, small boys, big change. 99 people are following you. This is so cute. Yeah, I love this. So thank you, Jimmy. Very, very excellent craftsmanship. Okay. Excellent. I highly recommend these. I don't know if he's still sending, what he's doing with these, but this is, store-bought quality. Highly recommend. Love this as a memento for the trial and all the things, right? It's just such a great, fun thing. And I just love it. So I would like to eventually have, maybe the Salem witch trial versions, which is Karen, Kelsey Fitzsimmons, and Lindsay Clancy. That's just my idea. But, Jimmy has to do what Jimmy wants. He's the artiste. He's very good at it. So I'm excited about that. I got that, and I love it. So thank you, Jimmy. Another thing I wanted to mention, one time, Auntie Deb would sometimes send us after like a chat. I mentioned this once before, but I'm bringing it up again in case anybody was there when this happened. Jimmy sent us somewhere. It was somewhere random, and it was this young Black woman, and I feel like she was definitely in a car, and her phone was just like sitting on the seat next to her, and she was driving and talking, and she talked about something. It was just interesting enough to keep listening, and a bunch of us were in the chat saying like, Auntie Deb sent us, hello, blah, blah, blah. And she was really ignoring it because she was driving. And then when she got to her location, I feel like she was on her way to work. And she picked it up and she looked and she goes, huh? What? Huh? And then she like immediately stopped the stream. And then she deleted the stream. Was anybody there when that happened? Because that was weird. Okay, that was really weird. So I told Auntie Deb about it. Maybe he'll bring it up in his chat. if anybody was there and remembers that, it was really interesting. So yeah, so that's happening. But yeah, so this Lindsay Clancy case, I think, is super important to expose a lot. That's what's happening in the medical field, the medical community. Again, I am not a hater of the medical community. I am someone who is a realist. First things first, I'm a realist. Oh, that reminds me of something. You know what? That just reminded me of something. Watch out. I was in Turtle Boy's chat the other night and I was texting some things because I still support Turtle Boy. Okay. Like I think he was a total jerk the way he behaved. And I made a funny song about him and all those other things. But like at the end of the day, I support his fight against, what's happening. No, I still think it's wrong. Right. And somebody came at me and was like, oh, what are you doing in here? Like, you're so fake and all this other stuff, And I'm like, what? This is so weird. Like, I can't believe, but normally I wouldn't say anything, but I was just like, whatever. Like, I don't know what your problem is, like we didn't have a problem before. Now we do. And I think I said, and then she was like, because you're fake, like basically calling me fake. And I just don't understand people like that. Like, do they not understand like nuance? I think it's because it has to be all black or white for them. Like either you're with this person and everything they do is godlike and you can't question it, or you're not with this person. I think that's what that is. I think that's black and white thinking. People who have black and white thinking like that, I think there's a lot of those people online. And typically, and I'm not saying this person in particular, but one of the things you have to be careful about when you have that kind of thinking is you're missing a lot of nuance, a lot of nuance. And then you have to deal with like human beings letting you down constantly because nobody's perfect, not even Turtle Boy. So at one point when Turtle Boy lets you down, that's the person that becomes the Turtle Boy derangement, because it has to be all good or all bad. Because this person used to love Jess too, and now she hates Jess. And it's because Jess said something about Baker, because Turtle Boy, she gets the impression that's what Turtle Boy, you know what I'm saying? It's that kind of black and white. And so, yeah, it's kind of weird, right? It's just a weird thing that happens, I guess. Hopefully people get out of that deception and delusion. That's a deceptive mindset. You're in delusion when you think that way. You might not realize it. And I pray that people like that get out of that delusion. I do. And I'm not being facetious at all. I'm genuinely praying that people stop acting in that way. I pray they find their way back to what I consider to be their humanity. And that requires empathy. It requires not watching everything. This black screen thing, it just distorts everything. Everything. So it does. It distorts everything. Yeah, but I just laughed. I actually wrote back, I love you. I'll pray for you. God bless you. Let's wrote back because it's just funny to me. It's like, I guess you don't understand me at all, and that's okay. I'll pray for you because I do love you and care about you. I do. But you're not going to silence me either. If I want to go into Turtle Boy's chat and I want to chat, I'm going to chat. It's funny. It's like people try to bully you into being quiet. And it's just like, what are you doing? You're a policeman in the chat of Turtle Boy for why? Why would you go after other people? Like Turtle Boy doesn't care about you. Just like Trump doesn't care about you. That's the part I don't get, where people get into battle and it's like, do you know what you're doing? Like you're blindly following someone, and do you even know how he feels? He's never said anything nasty about me or to me. He might not even know who I am. So like, what are you doing? That's kind of how I look at it. That's how I look at it. Anyway, guess where I'm going Friday? Friday, I am going to I'm going to Matt Rife, guys. I am going to Matt Rife concert, and guess where I'm sitting? I am sitting in the Golden Circle. I'm going to be in the table right in front of Matt Rife when he is on the stage, and I can't wait. So I'm really excited about that. And I'll let you guys know before maybe on the way there we'll talk about it or whatever. If you don't know who Matt Rife is, he's a comedian. It's pretty funny. All right, guys. Well, thanks for being here. I really appreciate it. And I can't get Jess's song out of my head. 24 on 24 gives me life. No other way to start the day. My favorite line in there is when she goes, oh my God, what is it? I'm just a baby. Your dad loves me more. And I don't know what the next line is, like, dun, 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 a typical Fall River whore, 24 on 24, gives me a life. Sorry, I'm tone deaf. Totally fucking tone deaf. Sorry about that. Anyway, I don't know what that one line is there, but that whole section there is pretty hilarious to me, so. And I've been watching J7 and Kane, and there's just like all this drama going on. And I just think J7 is hilarious. I think Jess is great. I think Auntie Deb is great. Turtle Boy, I still support his freedom from this. But right now, I will tell you that the Lindsay Clancy case is it's really important. No better way to start the day. 24 on 24. I love it. It's just such a great, like, happy song, you know? And Jess just is the gift that keeps on giving. I understand people don't like her and stuff, but I like Jess. I just think she's great, you know? So anyway, I love that she's covering this case. I love that she has back information with Reddington. I love all of it. So still, like, you know, I'm excited. I had volunteered to do like if she needed someone, because she's going on vacation and she's going to have people like fill in. I'm really looking forward to J7 and James Jackson doing one. That's going to be awesome. I volunteered to do one. I would love to do one if she would have me with somebody. I would go with anybody. I don't care. She could literally put me with anyone, and I would do it. It doesn't matter who it is. So that offer's still out there, but she probably has everybody picked out already. Either way, it's fun. And what was the other thing that was making me laugh the other day? Oh my gosh, JFK. If you guys watch JFK and him talking about the glare with Brian LTL and the Young Jerks was comedy gold. Like that whole section. I don't care what you think about any of them. It's still funny, guys. You might not like any of them. And it's still funny to watch the glare, the JFK show off, Brian LTL and the Young Jerks together doing to the glarer what the glare has done to all of them for years, I feel like. It's just comedy gold. It really is. And look, it's all in good fun. Everybody should be able to take a joke, right? So nobody should be upset about that. It's actually one of the funniest things I've seen in a long time. And also, JFK show off mimicking Jess Machado is also, I believe, hilarious. I don't think he's trying to be nasty at all. I think it's all in good fun. It's fucking hilarious the way he's like, oh, hold on, my stomach is inflamed or whatever. And then he's like, bunnies, best. I don't know. JFK show off is freaking hilarious. Okay, I'm just saying. If you guys haven't seen that, me laughing so freaking hard. All right. Anyway, that's it, guys. I'm gonna sign off now. Thanks for being here. And yeah, that's it. Let me just put up this little guy here.